Okay, good morning, everyone. Let's get started. I'm going to share my screen right now for the presentation. Okay, so thank you so much for joining this morning, this Hepatitis C webinar. My name is Stephanie Pina. I'm a community health worker for the New Haven Health Department, and today we'll be learning more about hepatitis C. Here's what our agenda looks like today. We'll have a brief introduction, a hepatitis C overview, statistics of Hep C in the United States, in Connecticut, and also specifically in New Haven. CDC's call to action in regards to Hep C, testing patients, and also patient resources. So hepatitis C is an ongoing silent epidemic in the United States. Historically, we see the highest prevalence of chronic hepatitis C among those known as baby boomers, those people born from the year 1945 to 1965, anywhere in between there. However, the newest cases occurring today are among young adults, and this coincides with the opioid crisis that we are seeing here today. Here's some hepatitis C statistics in the United States. We see an estimated here 66,700 infections in the year 2020. Also, an estimated of 2.2 million adults with new HCV infections that was recorded all the way from January 2017 to March 2020. During 2020, a total of 4,798 acute cases were reported, corresponding to 66,700 estimated infections. And this was just after adjusting because there was a lot of underreporting in the year 2020. In 2020, 41 states reported a total of 107,300 newly identified chronic hepatitis C cases. This graph was given by the Connecticut Department of Public Health Viral Hepatitis Surveillance Program. Here we see an overview of acute hepatitis C in Connecticut based on sex, female or male. And here we see in the data from the year 2017 to the year 2021 that 63% of males had acute hepatitis C and 37% female. Here we have chronic hepatitis C in Connecticut. We see almost double in men, 64% versus female, 35.3%. And in real numbers, in men from the year 2017 to the year 2021, 4,024 men versus 2,198 women. And we'll talk a little bit about why this is later on. Here we see the statistics in New Haven for chronic hepatitis C with 52 female and 66.2 male. Now, it is important to note in this graph of 2020 and 2021, it should be reported with caution due to the impact of the COVID-19 pandemic, because there was little access to testing and also other care-related services. So let's discuss some ways of routes of transmission in regards to hepatitis C. The most common way someone can have hepatitis C is through sharing contaminated needles, syringes, or other equipment used to inject drugs. Some less common but other ways to have hepatitis C is birth to an infected pregnant person, sexual contact with an infected person, unregulated tattooing, needle sticks, or other sharp instrument injuries. So here we have some symptoms of hepatitis C. The most common one is jaundice, which is yellowing of the eyes and or skin, fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, joint pain, dark urine, clay-colored stool, and diarrhea. Now, while all of these symptoms are very noticeable, there are other people who are asymptomatic. That while patients could have acute or even chronic hepatitis C, they don't look or feel sick, and therefore they don't know that they're infected. This is why it's so important that we advocate for everyone to test for hepatitis C. This is the CDC's call to action campaign. You can see these flyers, posters, billboards all over the United States. And they're urging everyone, all adults, they should get tested for hepatitis C to talk to their doctor because it could save their life. Testing your patients for all the providers online and all the medical students tuning in today as well for your future patients. This is what the CDC recommends for hepatitis C testing. Every person 18 years old and older at least once, all pregnant people during each pregnancy. So it doesn't matter if you were pregnant once and you tested negative and then you are pregnant again, maybe 2 years after, and oh, well, I tested negative my first pregnancy, I'll probably test negative the second time around. It's important to test during each pregnancy. Every person with risk factors, at least once and periodically if going. And these most common risk factors include injecting drugs or sharing needles. So if you or someone that you know does that periodically, then you should also test periodically for hepatitis C. If your facility or future facility that you work in does not offer testing for hepatitis C, we encourage you to send your patients to the New Haven Health Department for testing. Here you see this flyer that promotes our testing services, our address, the days that we test, the times, our phone number, no appointment needed. You can walk in and most insurances are accepted, or if you don't have insurance, it's just $20 fee. And here is my contact information. If you have any questions or comments, please feel free to email or call me. This webinar will also be posted on the New Haven Health Department website and on our YouTube channel. So feel free to also leave any comments or questions there, and we will get back to you. So, thank you so much for joining in on our webinar this morning, and I hope you have a nice day. Thank you.